Hi everyone, my name is Fran and I'm a nurse practitioner student from Auburn University. I am here to talk to you guys about heart murmurs. So first I want to start with a basic definition. Murmurs typically occur when turbulence exists in the wall of the heart or great vessel. Typically blood traveling through the heart is a silent event, however with a murmur the sound of turbulent flow is heard. When an incompetent valve does not completely close, allowing blood to move in both directions through the heart valve, this is also known as valve regurgitation, or stenosis occurs, which is narrowing of the vessel. Both can result in turbulent blood flow. Most murmurs are benign, such as a hemic murmur, which is due to hypervolume states, just as an anemia or fever. Other benign tumors include crescendo, decrescendo, or aortic sclerosis murmurs. So what puts people at risk for a heart murmur? Risk factors include previous diagnosis of bacterial endocarditis, rheumatic heart disease, or aortic calcification. Other risk factors include a family history of a heart defect and certain medical conditions including uncontrolled hypertension, hyperthyroidism, pulmonary hypertension, rheumatoid arthritis, and lupus. So what are three key questions that I typically ask patients when I'm trying to work up a heart murmur? The main thing that's important is to find out the major symptoms, such as chest pain, heart failure symptoms, palpitations, syncopal episodes, and activity intolerance. I always ask my patients about activities of daily living. Do they get tired walking to the mailbox? Do they get tired making up the bed? Do they become excessively short of breath with increased activity? You also want to ask if they have known about the murmur or if this is a new finding. This will help determine the route of diagnostic testing and plan of care. You want to ask them about their medical history. Have they been diagnosed with bacterial endocarditis, rheumatic heart disease, or aortic calcifications? Are they IV drug users, which is increased the risk for bacterial endocarditis? To confirm a diagnosis with a heart murmur, a primary provider would typically order tests such as an EKG, chest x-ray, or echocardiogram. So three physical examination components would include auscultation, vital signs, and a vascular assessment. So for auscultation, you want to listen for a heart murmur. You want to note any murmurs, including the location, the grade, and radiation. You want to identify S1 and S2, and any abnormal heart sounds such as S3, which is also known as a ventricular gallop. This indicates mitral regurgitation murmurs. It's also important to note the grade of a murmur. So grade 1 is typically a soft murmur heard in a quiet environment. Grade 2 is a soft murmur, but it's heard in a noisier, under noisier conditions. Grade 3 is a prominent murmur. Grade 4 is a loud murmur associated with a thrill. Grade 5 is associated with a loud murmur with the edge of the stethoscope tilted against the chest plus a thrill. And then grade 6 is a loud murmur typically heard 5 to 10 millimeters from the chest wall. For vital signs, you want to check for a narrow pulse pressure, which may be found in volume depletion and aortic stenosis. You also want to look for a wide impulse pressure, which could indicate aortic regurgitation, and you want to check for orthostatic hypertension, checking the blood pressure in a supine, sitting, and standing positions if your patient has had syncopal episodes. The next thing you would want to check the pulse and heart rate. You want to note the rate, the rhythm, the character, and the volume. It's important to check for bradycardia and tachycardia. You want to check the point of maximum impulse and the apical pulse. For vascular assessment, you want to check the temperature of the extremities. Are they cool, moist? This indicates decreased cardiac output. It can also reflect the environment or can be caused from vasoconstricting substances such as caffeine or nicotine. You also want to check skin color, noting any cyanosis, peripheral cyanosis, palmar erythema, and pallor. Checking skin color can assess the pore oxygenation level for a patient. That's why it's important to note. So common treatment. So treatment is typically aimed at symptoms. So helping the patient maintain a normal cardiac output, preventing heart failure, venous congestion, and inadequate tissue perfusion. So you might treat for heart failure, valve replacement, or surgical correction may be required. Typically for the asymptomatic patient, no treatment is required. So 3 priority teaching points. You want to educate your patient about lifelong management and that this is going to require lifestyle modifications such as compliance to drugs. You also want to educate basically they should understand the level of activity that they can do, and that activity restrictions might apply, and they need to drink a lot of water to maintain hydration. You don't want these patients dehydrated. Finally, you want to educate that they might need to take prophylactic antibiotics due to having dental surgery or surgical interventions. Recent years, there's been recommendations for the use of antibiotic prophylaxis before dental work, but this has undergone revision and is more selective, so it's really provider preference and based on each individual patient. For current guidelines pertaining to the use of prophylactic antibiotic therapy, refer to ACC or the AHA guidelines for prevention of infective endocarditis. But typically no prophylaxis is needed for benign murmurs. So that is all I have for you guys on heart murmurs. Thank you for your time.